Hi there. This video is a look at our blood pressure template as part of our pathology module. Some things are completely the same as all the others, and some things are a bit different because of it being to do with blood pressure. So as normal, on the left, we can see kind of outcomes from recent BPs. So the fact that they need a review of the antihypertensive, and there's a questionnaire that the patient could complete to offer them a dose increase. We can see the notes here from when the BP was last reviewed of this template. Worth noting that that's kind of more historic data now, and effectively has been overridden by a more recent home BP, which I've just entered here. We can see what their target BP is and the reasons why. We can see some historic data, and then we've also got things like what antihypertensives they've tried in the past and when it was first issued, what they've currently got on repeat. This summary is quite useful. Just worth noting that the date that's displayed here by System 1 is when that particular medication was last issued. And then other useful things that might be helpful. Top section, same as everywhere really. You can put that it's been completed. There's a few different options in relation to hypertension treatment, or alternatively you can say they need an appointment. This hypertension diagnosis code and form isn't going to work for this patient because they're already diagnosed, but this is really for patients who are going through that process where they're first being diagnosed or they've had the further tests needed and we now want to give them more information. Unlikely to use that a great deal, but it might be useful sometimes. You've got options to code a new hypertension diagnosis from here, to record that the pulse needs no further action. Again, that one you may not use a great deal. We used to do more with average pulses because of the way patients submitted data, and occasionally they do flag up for review. This section is then about personalized targets. So if you put a personalized target in, it will display some information here, essentially that they will override the system and the current target, and it will work to that as a clinic target. Obviously, you'd need to put in both values, not just one. And then when that's the case, it would display over here, this is the target. It will also display this is what the target would be if we weren't using a personalized target, and then this option, clear the previous ones, would be available. Finally, really, got home BP readings. So these are sort of different options that might be useful for you as a clinician or for admin staff. There's the drop down to record that home BP or ambulatory BP is either not indicated or declined. That one will launch a protocol which will take you through sort of step by step about first checking have they got their own machine and therefore what we're going to do. This is the one about you'd use for home readings where the patient has submitted some paper readings and you're kind of calculating the averages for them. You shouldn't need it, or you could use it if they've done the questionnaire. Often what we're doing now though is we're putting status alerts on the home screen to process those, just because it's a bit quicker to do it that way. This will record that home BP has been loaned to a patient, and this one for the BP has been returned, BP machine. Again, not all of that will be relevant, but there are things that we might think you may find useful. Plus, again, standard for all of these, the button to put that the review is in progress, and that will take them out of the kind of clinic review reports for 4 weeks. That's about it. I think the rest is fairly self-explanatory and standard. Give us a shout for any questions. Thanks.